Anatomy challenge. Question 1. At the renal hilum, which structure is normally the most anterior? A. Renal artery. B. Renal vein. C. Renal pelvis. D. Ureter. Correct answer is option B. Renal vein. The renal vein is the most anterior structure at the renal hilum. From anterior to posterior, remember VAP, vein, artery, pelvis. Which nerve pierces the coracobrachialis muscle? A. Median nerve. B. Radial nerve. C. Musculocutaneous nerve. D. Ulnar nerve. Correct answer is option C. Musculocutaneous nerve. The musculocutaneous nerve pierces the coracobrachialis, then travels between the biceps brachii and brachialis muscles. It eventually continues as the lateral cutaneous nerve of the forearm. Memory loop. Musculocutaneous right pointing arrow coracobrachialis. Which structure passes through the foramen spinosum? A. Maxillary nerve. B. Middle meningeal artery. C. Internal carotid artery. D. Greater petrosal nerve. Correct answer is option B. Middle meningeal artery. The middle meningeal artery enters the cranial cavity through the foramen spinosum. It supplies the dura mater and is clinically important because injury can cause an epidural hematoma. Memory loop. Foramen spinosum right pointing arrow middle meningeal artery. Which structure passes through the adductor canal but does not pass through the adductor hiatus? A. Femoral artery. B. Femoral vein. C. Saphenous nerve. D. Descending genicular artery. Correct answer is option C. Saphenous nerve. The saphenous nerve travels through the adductor canal but leaves the canal before reaching the adductor hiatus. The femoral artery and vein pass through the hiatus to become the popliteal vessels. Memory loop. Saphenous nerve right pointing arrow adductor canal, not adductor hiatus. Which structure passes through the esophageal hiatus of the diaphragm? A. Thoracic duct. B. Azygos vein. C. Vagal trunks. D. Sympathetic trunks. Correct answer is option C. Vagal trunks. The esophageal hiatus transmits the esophagus along with the anterior and posterior vagal trunks. The hiatus is located at approximately the T10 vertebral level. Memory loop. T10 right pointing arrow esophagus plus vagal trunks.